Sierra Leone is no stranger to the human, social, and economic devastation caused by epidemics. During the 2014-2015 Ebola outbreak, nearly 4,000 of our brothers and sisters died of Ebola, and many more died from non-Ebola causes due to routine and emergency health services being severely disrupted during the crisis. Of those that tragically lost their lives to Ebola, more than 200 were frontline health workers. This was a loss not only for their families and communities, but for their patients, the health system, and our nation as a whole. It is a legacy we will never forget. With only 9,000 health workers for a population of about 8 million people, we remain vulnerable in the face of COVID-19 and future epidemics, as we have limited capacity to undertake critical interventions such as vaccination drives. Health workers are our first line of defense, and we recognize the importance of making comprehensive investment in the health workforce, from the last mile to the health center to the hospital, to progress along the path to universal health coverage. An ample, well-trained, well-equipped, and equitable distributed workforce is vital to our current COVID-19 pandemic response, to our epidemic preparedness, to our ability to be able to provide high-quality essential services for all, and to the global health security agenda. We are excited to partner with local and international stakeholders such as Seed Global to build the workforce that our people need.
COVID-19 has affirmed the critical need for a well-trained, distributed, and resourced health workforce. Yet throughout the pandemic, current shortages are worsening as health workers are dying or leaving the system at a time when global crises demand their services more. We have had applause, but without ambitious enough action. Seed Global Health commits to invest in human well-being, in impact. We are honored to partner with governments like Sierra Leone's to train and deploy the health workers required to put shots in arms. We commit to scale our work in training and care to help expand essential services to an additional 3 million people, to expand and protect continued education, to ensure the pipeline of health workers is strong, and to align and generate the political commitment and resources to support health workers and save more lives. Seed Global Health commits to catalyze a social contract for health workers, to galvanize the needed action. Centered on principles that provide the evidence-based rationale, framework, and accountability, we aim to mobilize and align investments, policies, and programming around long-term, country-led planning to scale up and protect a fit-for-purpose workforce in service to the world.